Young people of all ages are experiencing cramping, tingling, and spasms in their fingers and forearms. They are clutching their hands and forearms in pain. They are flocking for medical attention as they are unable to write, brush their teeth, or play games. What we now casually term as cumulative trauma was in the early 20th century seen as a distinct problem and was named after the blue-collar occupations in which they commonly developed. For example, there was stitcher's wrist, bricklayer's shoulder, and cotton twister's hand. Doctors have looked at a variety of currently existing cumulative trauma disorders to classify this unusual clinical quandary, as the symptoms do not correlate with any existing disorders.
This disorder is difficult to diagnose and is referred to as HPS. The patients report clamping, numbness, and pain in their forearm and fingers. They often present in the office with their arm cradled in their lap and their fingers in a flexed posture. When performing this examination, the clinical test that confirms the diagnosis is to have the patient walk across the room. When the patient walks, the hand will fall against their leg and grasp the pants he or she is wearing. This gait pattern is the telltale sign of what we now refer to as HPS. An immediate referral to a hand therapist is indicated.
Hi, I am Donna Digit. The patients I have seen with this disabling disorder are extremely resistant to treatment of any type. The most effective treatment we have used in our practice is the PMS. We are submitting this data to the Journal of Hand Therapy in the next few weeks. These patients have had HPS or hand pant syndrome for more than 6 months. Notice the grasp of the hand on the pant leg? If you attempt to have them release the pants, you will see a slight problem occurs unless you implement the PMS. The PMS is simple, effective, and most importantly, cost-effective. I will now show you how it works. The PMS, or Pants Modulation System, is easy to apply and comes in many varieties and colors. Simply fasten to the desired tightness and release grasp. You can release your hand. I have your pants stabilized. As we implement the PMS system, you can turn as we go through the loops. Now we fasten the buckle. Now the pants modulation system is now in place. Our research lacks long-term follow-up, but we wanted to share the PMS technique so you can begin to use an effective treatment plan in your clinics immediately.
For more information on this growing epidemic or to purchase a PMS, visit www.handpants.org.
Use of PMS may result in pressure marks around the abdomen, compression of the sciatic nerve, rectal bleeding, or death. Do not apply the PMS if you have poor liver or kidney function or before consumption of large meals. Some patients have reported mild cases of hand pants withdrawal, which includes urges to loosen or remove the PMS. This is especially prevalent in individuals recently released from incarceration. Some patients have reported loss of appetite, loss of friends, and extreme parental happiness.